I am opening the public hearing testimony section of the Budget Committee.
Could you wave the gavel, please, Chair? Just
Oh,
wave it.
yes, thank you. That is, I got the lights down, now I need to get the wave down, right? Yeah. Okay, all right, thank you. Thank you very much. I appreciate that staff reminds me of that. Thank you. We will now start receiving public testimony. Anyone that's wishing to testify should begin by giving their name and address for the record. You will be limited to 3 minutes each. We're going to start with testimony from those who are in the room. And at this point, I have one card, and that would be Michelle Vinker. And Christina, will you be timing for me? All right, thank you. Thank you for being here tonight, Michelle.
Hello, Chair Smith, Commissioners, and Budget Committee. Thank you for your time today. My name is Michelle Vinker, and I am the Executive Director of NAMI Clackamas and the mother of 5 children who live with mental health and substance use issues, several who still live and work in Clackamas County. I've emailed you a full copy of my testimony, which I'm shortening here today to meet the time constraints. Increases in mental health issues due to the pandemic indicate that Clackamas County residents are going to need mental health treatment, resources, and support for themselves and their families like never before in our lifetimes. Education and support for family members of adults may not be immediately recognized as an important and integral part of achieving recovery and mental health or accessing and maintaining housing, but research and scholarly articles show different. SAMHSA says that family support can play a major role in helping a loved one with a mental or substance abuse disorders. Being able to offer support, family members can connect those in need with treatment, resources, and services to begin or stay on their recovery journey. The National Institutes of Health reports families are a vital, untapped resource for social workers in promoting independent living. Yet the concept of family support, as well as actual resources and services for families, has been slow to develop in the mental health field in comparison to other disabilities. Promoting interventions highlighting the family unit is particularly good fit for our Spanish-speaking populations, based on primary cultural values of family shared by Latinos of various geographic origins. Thank you so much for sharing, as I know I'm not alone, reported one youth after taking part in our Ending the Silence presentation. 91% of the thousands of youths who have participated in Clackamas County say that because of it, they now know how to help themselves or a friend if they notice the warning signs. Deputy Hatfield from Clackamas County Jail wrote about our new health and wellness series there that our adults in custody are now asking me when the next class will be and express interest in new curriculum to continue their progress. I have heard them recommending the program to others. One young lady touched my heart when she wrote, "I want you to know there is one less suicide statistic because of NAMI Clackamas." A mother wrote, "With your help, my son has applied for the CSAP program, something he said he'd never do. I don't know what led us to his decision, but I do know that because of you and NAMI, I was able to connect another dot and talk with people I would not have been able to otherwise. You give me the strength to keep going and remind me I don't have to do this alone." I want to implore you to find the funds to reinstate the $60,000 that the county cut and that funded both our vital volunteer coordinator and our Latinx programs. I also want to put a plug into using general funds to support other important mental health services, including the 24/7 crisis response teams. Families report to me that those teams are often busy when they are called on a crisis line, so police who are not hired nor adequately trained to be mental health providers are the only ones who are able to respond. You cannot meet your strategic priorities without fully funding mental health. And finally, I want to express my concern about the commissioners not being willing to find a way to fund the homeless support services originally meant to start on July 1st, at the same time that the other metro counties will be launching theirs. There is hope for people with mental health issues and their families. They do recover, but they need the help and support if your funding can provide. Thank you.
Thank you, Michelle. Appreciate your input.
The second.
May I ask a question for Michelle?
Sure.
Yeah. So Michelle,
Paul, what did you say?
I just want to just ask Michelle a couple questions. So Michelle, first of all, thank you. For 10 years now, you've been speaking to us about mental health and you know, with in our efforts to solve or work to solve homelessness, I've been ringing the bell for detox centers for drug and alcohol treatment and also for mental health treatment for the homeless. But of course, people, all walks of life, families experience people with mental health issues. And so I have discovered, you know, that there's not a very big audience for this. And it doesn't seem as though there's a lot of I don't know if it's empathy, or sympathy, or concern about it. And obviously, if the state wanted to make something happen, the state would make something happen. And I just don't understand what the block is, or what the challenge really is. But I did go on the state website. I want to share this with you. I went on the state website and on mental health, and it cited that there is a basically, can't remember the exact words they used, but a labor shortage. You know, mental health people actually to hire, to put to work, to treat the people. And that's not Oregon alone. That's a lot of other states as well. So there's a capacity issue. So my first question to you, and I have one other statement or question for you after that, and that is, what do you see because if the people aren't there, I mean, what do you see as the first step? Knowing all this, if you know this and you're nodding your head up and down, what do you see really as the first step? It doesn't seem to me like it's a funding problem as much as it is an organizational effort to make it happen.
And it is a funding problem too, very much so. But there is capacity issues. There aren't enough people. But there's also a huge amount of stigma. We don't have little cute puppies or kids with big eyes. And in fact, it's something that a lot of people are afraid of when we see someone who is different than us. And you know, right now we're talking a lot about our black and brown neighbors and friends, but people who act different because of mental health issues, we want to turn away. We don't want to deal with it. And until we can decide for ourselves that those people are worthy of our help and our support, then it's not going to happen. So we need people like you guys to step up and say that these people are vulnerable, that this is a disease, it's not something that they can help, and that we're going to do something to help them in the same way, you know, like I said, with developmental disabilities. There's so much more available there. We need to be able to put our friends and neighbors, we all know them, on that same level and give them the support and help that they need financially, spiritually, housing, the whole 9 yards. And the pandemic is just making it worse, not only through the pandemic itself, but now they're saying about 1 in 4 people who have COVID now have what they call long COVID, which is causing a lot of mental health issues too, everything from psychosis to depression. So it's going to be coming even worse, and we need to get in front of it.
Thank you, Michelle.
Yeah, thank you. So the last thing I want to say, your last statement, or near the end of your testimony there, you mentioned the supportive housing services July 1. July 1, just so everyone knows, and the people that are to testify afterward, I'd like to know how many people have addressed or went to Metro and asked them why their projection of having the money to us on July 1st of 2021, you know, really about 5 weeks from now, isn't showing up. Because we're all stunned by that. We're all disappointed by that. And I don't know why people aren't even my colleagues are not more outraged than we already are. So that has to be answered. And I'm looking for, frankly, an explanation from someone from Metro to say what went wrong here, because all of our staff were messaged, not just Clackamas County staff, Multnomah County staff, Washington County staff, and Clackamas County staff, were all of us, people on the committee, were led to believe that on July 1 of 2021, we would have the funds. And they're not coming.
And I can't answer that. I know that I was just in a meeting with the Here Together Committee, and they were saying that Multnomah County and Washington County are making a way to provide those fundings until they can get them from Metro, which they figure is about April 2022 was when the vast majority will come in. And for whatever reason,
It's also my
Clackamas County-
understanding that the Board of County Commissioners is going to be addressing this issue in a meeting the 1st of June. That might be one that you might think about attending, Michelle, along with other folks that are interested in the topic. And that's a Tuesday meeting, so I would imagine it would then go to a Thursday policy session. I'm
If
just
there
kind
was
of,
if there was a decision.
you know, yeah.
Michelle, I want to correct and set something straight for the record. You said Washington County and Multnomah County found a way. Their way in Multnomah County was to take out a loan, a good faith and credit loan. on a promise that has not been realized from Metro. This county is not willing to put our Clackamas County citizens in that kind of economic peril. Washington County has borrowed against their contingencies and reserves. Obviously, they think that no emergency would be ensuing. And I will remind anybody listening out there, Clackamas County residents did not vote for this. And that's who we answer to. So as we continue to discuss this going forward, yes, it's going to be a very difficult decision, but in Clackamas County, we're a little bit different. We didn't vote for it. We don't have the ability to go out and borrow hundreds of millions of dollars like Multnomah County does. And the other two counties don't have the portfolio that we do. We offer so many different services and agencies and departments in Clackamas County. As a matter of fact, we're the third largest county by population, but we have more employees than Washington County because of all the different services. So we need to be very mindful of that. I do appreciate your advocacy for the homeless. We will get this figured out. And as I said before, timing is on our side to figure out exactly what Metro plans on allocating to us. It's not that we're not going to do this. We will do it, but we will do it with the best budget preparations that we know how at this time. And thank you very much for coming today.
Thank you for coming, and I would certainly encourage you or any others to at least watch that meeting on June 1st and then see when they're bringing it to the policy discussion.
I will. Thank you.
So, you're welcome. Thank you. I am now going to turn this over to our clerk, Christina Terwilliger, to call on those on Zoom who wish to speak. I want to remind Zoom view speakers, that we're looking at no more than 3 minutes for each presentation. Thank you. Christina?
Thank you, Chair Parks. And now is the time for public comment via Zoom. If you would like to speak, you can hit your raise hand or *9 on your phone. I do want to remind everyone that this is about the budget committee. And if you wanted to give public comment on any other topic, you can reach us next Thursday at our business meeting where we do have public communication as well. So I will just go ahead and start with our list. It looks like we have 8 hands raised right now. First up is going to be Chris Waller. Chris, go ahead and unmute yourself, state your name and area of residence, and you have 3 minutes to speak.
Chris Waller, Jennings Lodge. The budget hearings this week have been extremely educational. Over and over again, we have heard the hardworking professionals of our county come forward and outline everything they have done for our county and its people, despite budget cuts, pandemic, fire, and storms. There were times this week when the chair of the board seemed to rule by fiat rather than by consensus, such as during the Housing Authority presentation when she engaged in a rant about Metro and abruptly ended the hearing, cutting off Commissioner Leenstra, who appeared speechless and aghast by this breach of protocol. This is not how our county should work. We saw much better examples of how our county should work when some commissioners asked informed questions and treated presenters with the respect they deserved. We also saw it in Gary Schmidt's excellent orchestration of everything going into this process and Christina Terwilliger's constant support. I ask that you all support the budget as presented and not consider any additional cuts to any budgets, especially those that provide much needed services to the people of our county. I heard over and over again this week from so many departments about how they have right-sized their budget. There is no fat here to cut. These departments have done a great job making do with less, and they should be funded for at least the amounts that they requested. Thank you.
Okay.
Thank you, Chris.
Thank you.
We'll go ahead and move on to the next. This is going to be Simon Fulford. Simon, go ahead and unmute yourself, state your name and area of residence, and you have 3 minutes.
Good evening. Thank you, Chair Smith, members of the Budget Committee. My name is Simon Fulford, Executive Director of Parrot Creek Child and Family Services, and I'm speaking on behalf of the Safe Kids Coalition for Clackamas County. Children across the Clackamas County are finally getting back to their normal lives and hopefully will be returning to their classrooms full-time in September. We know families have faced unprecedented challenges due to COVID and compounded by other natural disasters that the committee has heard many times. These were layered on top of already many systemic inequalities and injustices poorer and communities of color are faced with. The Safe Kids Coalition represents more than 70 county businesses, nonprofit, and civic groups. The coalition has coordinated with its member organizations to identify the priority services that will be needed to address the impacts of the last 18 months related to trauma and the safety of county children and youth. As a coalition, we urge the county to make adequate budget investments in prevention and response services for our most vulnerable children and families. As prudent stewards of public funds, we urge you to capitalize on the efficiency and effectiveness of nonprofit, community-based organizations that deliver these critically needed services. Targeting smart investments in community organizations who are able to respond quickly to the ever-changing needs of children and families, who can mobilize additional resources not available to government entities, who are nimble, passionate, and motivated to deliver real and measurable impacts, pays social outcomes, and delivers long-term cost savings for the taxpayer long into the future here in the county. As you finalize this and future budgets, we recommend that you see the nonprofit sector as key and equal partners with the county and as the experts able to deliver frontline services in our communities. I'd also like to comment and endorse that as a coalition, we're very troubled to hear the possibility of the supported housing services funding not being made available on July 1 to start the critically needed services here in Clackamas County. Dozens of nonprofits have put forward excellent service proposals, and I'm sure there are fiscal means to get the funding that will be 100% reimbursed or provided through the Metro funds so that we can start these programs on July 1st. I'd also heard ideas of the county using federal ARP or the American Rescue Plan funds to backfill county budgets, and this doesn't seem in line with the intended use of those federal funds. I thank you, and I know you have difficult deliberations.
Gary, we have an opinion from legal counsel on other funds, the use of other funds used for bridge financing on this. Could you make that point of clarification for us?
Yes, our county council sent a memo today, which I'll do my memory. So he did say that the use of the federal ARPA funds, there has to be a direct correlation to COVID. And it's unclear. It's possible we could use the ARPA funds, but it's not entirely clear unless we can absolutely demonstrate the connection to COVID, which in many cases we can. Other than that, all the other kind of options that you have are limited on how to do this bridge funding.
Rental assistance, addressed rental assistance, we're not able to use
Right, we
that
cannot use
either
it,
because
correct.
of the Oregon revised statutes allows for direct payments to those affected, either the landlords or the tenants. And then also there was a third one that I don't think it's tenable whatsoever. So all these good ideas that our board members have come up with for this, I think we're just gonna have to wait and see what we get. And we have time, we have a whole month to figure this out. Thank you, Gary.
Well, with all due respect, and I'm not differing with anyone per se. I'm not pointing the finger at anyone here, but it seems to me that if Metro and the organizers of this measure misinterpreted or made an error, fine. If everyone believes the money ought to be rolled out, maybe Metro should figure out a way to roll that out, the money somehow, and roll that out in a way that's fiscally sustainable on a glide path that, number one, can meet the debt service and then give the counties the share, small, big portion, or what it may be. But it seems to me that to have the burden pass on us, to have the burden pass on a county that just made a huge decision on May 5th, by the way, a huge decision that's going to retire belt tightening for the next 35 years to build the courthouse. Okay, that's a big deal. And this budget's tight, and next year's going to be tighter, and the year following is going to be tighter. So to me, it's incumbent upon, frankly, Metro to come up with a solution, not us. And why did we just learn about a court case over the weekend? So no one told us. Metro didn't signal that. No one told us. Even the amount of money's in jeopardy, so how much do you borrow? Sorry for my passion, but getting the bad news today from legal counsel was not very not very reassuring.
Martha wants to speak.
Martha,
Your microphone is off, Commissioner.
Oh, there we go. I have never been so upset with a regional government, our colleagues, than this. This is so wrong beyond measure because we were told we were going to get that money July 1st. That was a promise. And I suppose, ladies and gentlemen, maybe we shouldn't build a courthouse then.
What?
Maybe we shouldn't build a courthouse. Maybe that money we're setting aside needs to go towards this. I don't know how Judge Steele would feel if we told her that. I don't know how those folks down in Oregon City that are kind of working in a death trap will take it.
Commissioner Schrader, could you make sure you're talking directly into the microphone?
Right. I'm just saying that we have prioritized things. Our homelessness and providing housing for people has been one of our top priorities. And we have been let down in a way that I have never been let down before from colleagues who are supposed to be supporting us. And, you know, this has been rough on me because I have to tell you, a lot of folks in this county don't care for Metro very much. So perhaps we should look at our capital construction and just kind of, you know, we just don't go there. Then maybe we could find the money. I don't know. I want the courthouse built because I have a daughter that's a prosecutor. I wouldn't want her down there in that death trap. I don't even know if we could, but I'm concerned that we're not going to be able to find the money right now after the promise has been broken, woefully broken. Then we will have to decide what else we are going to cut in order to fund the housing initiative by July 1st. And we could do that tomorrow, colleagues, if that's where you want to go.
Just a quick comment on the courthouse. That
Yeah.
is mandated by the state of Oregon
I know.
that counties provide courthouses.
Right.
Just so you know, we went as long as we could in this county without.
It's not a preferred alternative for me, but,
No,
but
me
I'm
either.
just saying that these are the kinds of decisions that we're faced with. And I feel like we're trying to get blood from a turnip here, truly.
Well, it sounds
And
like
I think
something
Metro is responsible for getting us those dollars on July 1st, so we can roll this out.
definitely a fuller discussion than what
And-
we
and
can
I would
provide this
ask-
evening. I hope it's not an either-or situation, because that would not be what anybody
Wilda,
in this room would
then I
want.
think tomorrow when we have our budget discussion, well, actually, we are going to have a budget discussion as a commission about this. We will. But I have to say, I have never been so disappointed and so upset
Understand.
over this. And it's just wrong. And I wish all our allies out there in the community that knows this board has always supported NAMI, has always supported the Safe Kids Coalition, has always supported, the workforce move to get childcare. We have been good on this, all of us have been. Would you please talk to Metro and ask them why? Why didn't they have the job done? Why didn't they tell us?
How about if we have that full discussion tomorrow, and please let's get on with the public testimony. We have people waiting, I believe, this evening, correct? Thank you.
Excellent, I can do that.
Thank
Just
you,
wanted to
thank you, Commissioner Schrader.
Just wanted to thank Simon for his testimony. We will move on to Gary Marshkey. Gary, go ahead and unmute yourself. State your name and area of residence, and you have 3 minutes.
Hi, my name is Gary Marshkey, and my job is friend and fundraising for NAMI Clackamas. I want to thank the County Board of Commissioners for their consistent support of mental health, and specifically NAMI Clackamas. May is Mental Health Awareness Month, and it's a perfect time for both reflection and rejoicing, as we've come so far with such a long way yet to go. I want to remind you that our vision at NAMI Clackamas is health, hope, acceptance, and community for everyone impacted by mental illness. Our mission is improving the quality of life for everyone affected by mental health issues through education, support, and advocacy. That's not just the 1 in 5 that live with a mental health issue. It's the 5 in 5 that are impacted by that. And the key to bringing that vision to reality is in the message that you are not alone. You are not alone because NAMI offers classes and seminars that bring you the knowledge and skills you need to live your best life. You are not alone because NAMI offers support groups where sharing is caring and stories can heal. You are not alone because NAMI will advocate for you and help you navigate the myriad of challenges that you may face. And best of all, you are not alone because all of those services are free and delivered by staff and volunteers with been there, done that, made it through lived experience. NAMI Clackamas deserves your support because each and every day, with each and every breath, we spread the message of hope and support. You are not alone. Thank you in advance for your continued support.
Thank you, Gary. We'll go ahead and move on to the next. We have Michael Weber. Michael, go ahead and unmute yourself, state your name and area of residence, and you have 3 minutes.
Thank you, Christine. Michael Weber, Jennings Lodge. First off, kudos to Gary, who kept things running like a fine Swiss watch. Second, I would like to express my appreciation for all the hard work put into this process by the rank and file employees of the county. What I have heard throughout is prepared professional presentations, and the speaker for every department came ready to answer any questions put forth. We must remember that these employees have dedicated their lives' effort for the betterment of Clackamas County. Every commissioner should treat every employee with respect during their presentation and thank them after. It is good for morale, and a motivated employee will go above and beyond in their efforts. A demotivated employee will, at times, watch the clock and do the bare minimum to get by. Please keep this in mind as you endure this lengthy process. Commissioners should not pick favorite departments to lavish their praise on and treat with disrespect the ones they don't favor. Thank you.
Thank you, Michael.
Thank you, Michael.
We'll go ahead and move on to our next one. That's going to be Gisela Foster. Gisela, if you can go ahead and unmute yourself, state your name, area of residence, and you have 3 minutes.
Yes, thank you. My name is Gisela Foster. I'm a resident in Portland, Oregon, but I do work for NAMI Clackamas, and I'm very passionate about mental health services in Spanish. Hundreds of Hispanic families are struggling with the effects of COVID-19 in addition to emotional effects that are affecting children and adults. NAMI Clackamas is providing presentations in Spanish via Zoom to families in Clackamas County. We have a wonderful, amazing professionals around and helping us during our presentations. We have family from all over Clackamas County via Zoom. We have family from all over different counties, from Washington, from every other place, especially in Clackamas County, looking for help, looking for support. The presentations create opportunity to establish a conversation, create awareness where families can find resources available in their language to support their loved ones. NAMI Clackamas is using social media to reach thousands of families with information to the community and cities during this pandemic. During this challenging time for families, NAMI Clackamas is very active, providing a lot of support to Hispanic families with resources in Spanish. Presentations in Spanish about mental health produce a reduction in the stigma around mental health because families can talk about mental health without fear, using terminologies that are appropriate and looking for local support in health centers and clinics. We truly appreciate your support for this specific and really, really important service. We have a really important also testimony about Maria Delgado, one of our leaders and activists. Maria was present in one of the classes. Maria sent this really important piece of testimony that I want to make sure you all know. Maria, she's saying the testimony here. I'm going to read this. Through this platform, I want and I need to share the importance of continuing supporting NAMI Clackamas services because of people with emotional and mental health challenges are having a family or having a family member with mental health disorder is very, very crucial. I'm a mother of 2 older children and one of them is 23 years old. In fact, because of emotional health, he has different diagnoses. But when I hear about this mental health presentation from NAMI Clackamas, this helped me to understand about mental health from NAMI Clackamas. It helped me to understand more about mental health, even though I have the same emotional mental health that I have been in services with a therapist. I want to say to all of you, thank you so much for your support to NAMI Clackamas. And I want to ask you to please continue providing all the support to NAMI Clackamas, because a lot of families from all this wonderful, nice county really, really need your support, especially during these specific and very challenging times. Thank you.
Thank you, Gisela. We'll go ahead and move to the next.
Chair Parks, may I
Oh, I'm sorry, yes.
provide just a little bit of clarification, because it's now come up twice in the testimony, and I had a conversation with Michelle, wanted to get some clarification, so just to put this on the list, so I don't lose this. There was a cut of services for Latinx outreach for mental health through our community health centers. And in my work through that council as the liaison, I understood that that function was going to go out for open procurement and that it was not cut. So I just want to put that out there to get that question answered before our deliberations tomorrow. Does that make sense?
Yes.
Okay.
Thank you.
Thank you.
All right, thank you, Commissioner Fisher. We'll move on. We only have 2 members left. Three members left. Next up is Lori Wagner. Lori, if you can go ahead and unmute yourself, state your name and area of residence, and you have 3 minutes.
Lori Cremona Wagner, resident of Clackamas County in Lake Oswego and board member for Clackamas Women's Services, which has served the county for over 35 years. Right now, domestic violence is on the rise in our county. Statistics from the Clackamas County DA's office show a 35% increase in cases compared to the historical average. And that's why now more than ever, we need to help women and families successfully transition out of domestic violence situations. And why we are so disappointed to learn that Clackamas County is divesting in both the CWS emergency shelter that services victims of domestic and sexual violence, elder abuse, and trafficking, as well as Casa Esperanza, the Northwest Family Services culturally specific emergency center for domestic violence victims. The CWS shelter program is a consistently full and highly utilized resource. And since the onset of the COVID-19 pandemic, our crisis and support line has experienced a 35% increase in requests for the shelter. During the last year, we've stayed open 24/7 during the pandemic and provided over 12,000 emergency shelter bed nights to over 370 adults and children. This far exceeds our previous rate of 150 adults and children annually. And 10% of the shelter participants are from the rural community and over 50% are from the BIPOC community. The Clackamas County General Fund grants account for about 3% of our budget, and we have relied on this longstanding partnership to ensure victims fleeing violence have access to the shelter. During our 11-year partnership, we've only received 1 cost of living increase in the grant, and now the funding is being cut 10% at a time when the service is so direly needed. Thank you for the opportunity to speak with you today.
All right, thank you, Lori.
Thank you.
I'm going to move on to the next one. We have Theresa Melville. Theresa, if you can go ahead and unmute yourself, state your name and area of residence, and you have 3 minutes.
My name is Theresa Melville, and I live in Happy Valley. As you are fully aware of the overall budget cuts last year, as a born and raised constituent of Clackamas County, I am sincerely concerned for the ripple effect we are already spiraling into. As I know the Commission is fully aware, decades of research have recognized the correlation between our unhoused individuals and mental health. As the stay on rental housing is lifted in the next coming months, if we do not do something about the inadequately funded 24/7 crisis line and mobile crisis response team, we are missing an opportunity to utilize supports already in place and shown to be effective to reduce larger financial constraints on Clackamas County taxpayers. The crisis line continues to be overwhelmed with crisis calls. Individuals who have never experienced a need for mental health services have reached out to the crisis line in this last year. The rates of need for the crisis line and the mobile crisis response team is only going to continue to escalate as those already struggling start to lose security and protection in the next coming months. We are already reduced to the minimal and have seen the ripple as more and more tents, RVs, and rundown vans park closer and closer to our neighborhoods. It is obvious there is an outcry from the community of the need to do something about the current state. If we do not adequately support the mental health needs here in Clackamas County, how long is it going to be before our beautiful community college campus is converted into a tent camp because our streets and parks are already full? I'd like to respond to Commissioner Chavez. Earlier, you had asked Michelle from NAMI regarding inadequate staffing for mental health services. I am a licensed substance use dependency counselor, and I'm currently working towards my master's for an LPC. I would agree with Michelle regarding the acknowledgement of it being a funding issue, as it is in part due to the cost it takes to obtain your CADC, to work with substance use dependency, and then the triple the amount to obtain your licensed professional counselor. When I'm done, I will have invested $85,000, and I'm looking at employment averaging only slightly over minimum wage with 5 times the caseload recommended for appropriate care. I will be honest, I've never considered moving out of Clackamas County. But when I'm looking at $85,000 in student loan debt, I can't afford $18 an hour to pay even my loan bill. And then I'd also like to add to Commissioner Schrader's thought. I recognize there is numerous safety concerns with our current courthouse. I've been there recently, and it's a scary place. The decision to rebuild was made before we as a county endured 3 major crises.
Teresa, I'm
Sorry, am I out of
sorry to
time?
interrupt you. Yeah, the 3 minutes has passed.
Sorry, I apologize.
No, we appreciate it. Thank you so much for your comments. And next up is going to be Monica Gutierrez. Monica, if you can go ahead and unmute yourself, state your name and area of residence, and you have 3 minutes.
Thank you. My name is Monica Gutierrez. I'm living in the Hillsborough area, Washington County. I'm working in a Head Start school as well. And NAMI has been very helpful for me as a Latino mom of a 10-year-old daughter. I'm so happy to have them in the community because I suffered in the past with anxiety and panic attacks during 3 years. And knowing that NAMI support me when my local health provider didn't understand me because they said maybe it's something that is happening to everyone, but that's not true. In my family, I'll never experience something like this, and I didn't know anything about it, but NAMI helped me with their advocacy. They also provide me many writing materials where I really believe they know me because they describe everything that I was passing through. Then my daughter, when she was 7 years old, right now she's 10, I'm feeling better, but she suffered with depression as well. If I should know before, when she was in this stage, more about NAMI will be really easy for me to overcome. But now I know that NAMI is there for me and that I can find a positive mental balance because they equip me with tools that go beyond the basic ones. I really appreciate if you can think as a person that you can see will look like we are healthy, but inside of us, there are many things going on, like heartbeats rising up every week, 3-4 days by week. I'm a working full-time mom, and was very, very bad for me having those times. But now that NAMI is there, I know that I can feel understandable and I can feel motivated because I'm not alone anymore. I need more organizations like NAMI in our community that support my mental and health in all the ways they can.
Thank you.
Okay, thank you, Monica. And it looks like that is the end of our list.
All right, thank you very much. And there's no one else in the room, no other spectators. And I understand we received a couple of emails, and so those will be entered as part of the official record. So very good. Thank you so much. With that, I'll close this public testimony part of the evening. And certainly thanks to all of those who participated in the good discussion that went on. In just a moment or two, we'll recess this meeting from today, and we'll be here at 8:30 in the morning, where we will begin deliberations and discussion about what the 21-22 budget will ultimately look like. Commissioner Fisher?
Yeah, just before we adjourn, I wanted a couple things. I wanted to just comment with Commissioner Schrader, but I understand that we cut that off because we need to get to the testimony. And to really all of us, I think it is really frustrating what's happened with Metro and the dollars and all of that. But I'm wanting us to focus on the people of Clackamas County, the people that we serve, and obviously there was a miscommunication and a staffing error somehow with the communication about how those dollars, there was something that got messed up. But I want to just caution us against blame and looking for solutions. I really appreciated what Chair Smith said about, we'll just got to try to figure this out. And you know what? We are different than than Washington County and Multnomah County. We don't have we don't have an income tax, for one, like Multnomah County does, that has more dollars. And it is more challenging for us. So I do want to caution, just for our emotions, about how frustrating it is, and just focus on solving the problem, because the commitment is there. So I wanted to leave us with that thought. And then also, I did receive, because I was asking questions to our attorney, our staff has been engaged with Metro to discuss these issues, to come up with some money, and that is in process and in the works. And I appreciate Chair Smith saying we are going to talk about this, all the details of it at a time when we can fully flesh it out. But just to lower the temperature in the room is what I'm wanting to do, and just to say there's a lot in the works, and I feel the commitment and concern. I really applaud our staff, Gary, in looking at it, and I'm pretty certain that Elizabeth Comfort and those, I don't want to call you a guru, but I just might, and I know that Rich Swift and Ed Johnson, everybody is looking at every rock, and if it's appropriate for us to look at that exactly correct through this process, or if we do it next week, I think that, either way, we're going to get to a solution. One thing that came up today that I want to put on our list, I'm not sure if anybody else caught it, but when Lori Wagner, from the board member from CWS, was testifying, I am interested in understanding more about the 10% cut that she was referring to for the Clackamas Women's Services Shelter and our culturally specific shelter, to get more information about that. You already got that on there?
Aren't those in H3S's budget? Administrator Schmidt?
I can answer the question tonight, although we can get more details for you tomorrow. It's in your budget book under Health, Housing, and Human Services, tab 12, page 39. It's under Children, Family, and Community Connections. The Prevention Services budget was reduced due to a reduction in funding, and part of that was the general fund. The general fund has remained flat, but expenses have increased in that program. So there was a 10% reduction in pass-through funds to community organizations. So the total amount that's in deficit is $132,000. So you could decide tomorrow if you want to reinstate, give extra general fund to that department to cover those expenses, but the federal and state funds are flat as well. But it's on page 39 of your budget book.
Thank you, Gary.
Thank you. Paul, Commissioner Savas?
Yeah, so I'm just going to deal with the last one first, and that's just address Gary's comments. So as I understood Lori Wagner's comments, that, and I understand, heard it from elsewhere, that because of COVID, there has been this surge. And as I read the interpretation of the APRA dollars from Mr. Madcore, that backlog is COVID-related. So therefore, I possibly would make an appeal to Mr. Madcore to read into that. I already have in another matter. So I think that might, to take care of that surge, I think that might be eligible money for the APRA funding. Okay, so so I'll leave that alone for now. The other thing I wanted to basically touch on to Commissioner Fisher's comments is that Commissioner Fisher, honestly, I'm not blaming anyone, but no one communicated with us until the final end. When you go back and listen to the April meeting, the April 13th or April 14th meeting when we approved the LIP, listen to what everyone said. I remember the emails, the text, the phone calls, people urging me to support it so we could have those dollars available. Everyone was passionate about that. I've been passionate about it. No one called us and told us, oh, by the way, this is in court. No Metro counselor, no one. Gary got a message early last week and didn't get a document until the middle of last week. Okay, I had to read in the newspaper that there's a court case. Did anyone share that with me? No.
You weren't the only one.
I know. Oh, I know. That's my point. Where's the communication? So
I had heard on OPB quite a while ago that
Commissioner Fisher, there's a number. I'm not pointing the finger, but you got to realize we're all upset. And we're upset for a number of reasons. The money's not there, the communication was poor, and to come on the back of us, frankly, on the back of the counties. Frankly, I think there's a way to make this happen, not alone, but I think they can do that internally at Metro, okay? And flow the dollars out gradually and ramp up and be able to meet the debt service to make up the difference, if that's what everyone wants. But it can't be upon us. We don't have it.
Well, there will be, it's my understanding that on Monday afternoon at your board meeting, you asked for and sought specific information from Metro so that you could have that within this next week. So hopefully that'll be forthcoming in a timely manner. And
We were discussing this on Tuesday, June 1st. Staff is preparing memos for you, and you'll have a discussion. You have two separate actions here. One is a supplemental budget for the current fiscal year, which you will do separately from this process, and second is you're preparing the proposed budget, the adopted budget for next fiscal year. So you have two different actions here. I propose you do the supplemental budget process first, which you'll talk about next Tuesday.
Right.
And then although tomorrow, though, you're going to talk about what you want to put into this budget for next fiscal year.
okay, all right,
I'm
thank you.
confused about supplemental budget, what you're talking about.
So if you're going to do bridge funding, you're going to do that in the next 30 days before July 1st to prepare for a July 1st start date, which means
Right.
that's the current fiscal year, of which you do a supplemental budget for the current fiscal year
Okay, thank you.
before this fiscal year ends.
Thank you, sorry, my brain didn't catch up with you fast enough.
Marks, I'd like to say something.
Commissioner
again,
Schrader.
too. And I know I don't want to keep us here too longer. Yes, I'm very upset, and the reason I'm upset is I've been here the longest. And I've served with most of you on other issues before. I have always supported personally, financially, thousands of dollars to all these organizations, particularly Clackamas Women's Services. And I think if you ask them that I'm on a grant-making body, and I believe because of my work, they got their grant. So it makes me heartsick when I feel as I'm getting pushed into a corner between making a choice between what is fiscally responsible and what isn't fiscally responsible. I feel like I'm caged right now with this. And I've worked with all of these folks for years, supported them, donated, given dinners. Of course I support them. And we need a new courthouse, and the only reason I brought that up was I was the only person that voted against the Development Services Building back in the day because I was fearful that it would take away from services. And if you're going to put services before a building, I've always chosen the services. And I know there's probably no direct nexus to that, and I know that the courthouse is necessary, but I was trying to make, in a very real way, a point about what our priorities are. We prioritize this courthouse, and we're having to do new kinds of financing in order to make it happen. It's already kind of down the road. But now we're hearing, oh, well, you're so bad because you won't provide the services to people, because somehow you can't find the money in your budget. Well, we could do two things. We could borrow from Metro, I suppose, but there will be strings attached, I can guarantee it. We will not have the flexibility. I think that's a real issue, that we will be told how we spend it, when that wasn't supposed to be the deal with an IGA, so there's that piece of it. And we know our county, and we should spend it with our housing authority as we see fit. I think that's a real issue for me. And the other piece of this is, if this is our priority, then we have to deprioritize something else. Now, we'll get through the budget tomorrow because we're not going to talk about this until June 1st. But I would strongly urge people to tell us what your real priorities are, because we've chosen other priorities, and not that this isn't a priority, but when we have an expectation of follow-through from our local government, and there's not follow-through, and maybe they can give us the money, I don't know, or some kind of a glide path. But I just want to let the advocates know, please remember, I have always been here for you. We wouldn't have the Children's Center. I helped start that center. I fought for money for Clackamas Women's Services multiple times at the state level as well. And I've worked with them to get grants. And Parrot Creek knows I have always been a supporter. And I don't know what Here Together is doing to help us out with money, or can they help us out with something? You know, I just believe that pushing us into a corner when we're trying to prioritize and do the right thing is just making me heartsick. And I think people need to be aware of that. And not because it's all about me.
Well, just as a budget committee member, I will look forward to you getting the information from Metro about just what is going on and how they intend to help you solve it, and hope that that is in fact what they will do. So I thank you for that.
We just haven't had much in the way of communication to know. And I just want to make it really clear and plant the seed for someone out there to think about this, to convey to Metro. And I wanted to get as much documentation before I called any of my Metro counselors, because I don't want to just go off on a tangent without really having the facts. So I want to get the facts, but they're not. I thought that we would have more by now, but we haven't.
Right.
And that is, Metro is the
That's what's coming in the
recipient.
next day or
Metro
two.
is the one to put the measure out there. They're the recipient of the dollars. They're the logical one to bond against the revenues they receive.
Yes.
Okay? We may or may not get whatever amount we may or may not, we don't even know what we're going to get. It's not logical for us to bond against revenues as a second or third party. It's logical for Metro to bond against the revenues they receive and divvy that out to the counties. Not Clackamas County, all three counties, and a glide path upward. Let them be responsible for the debt service. That's the way out.
Well, I'd certainly forward that solution to them. All right. Thank you all very much. We won't adjourn. What we'll do is recess. How's that? We will recess this meeting until 8:30 tomorrow morning. Thank you.